All right, guys, so we are here with our final piece of our education teaching, and this is the flu and pneumococcal vaccine teaching. So we're going to talk a little bit about the flu vaccine first. So it's highly recommended that patients who have COPD, or anyone in general, but especially patients with COPD, should get the flu vaccine yearly. Patients who have COPD have a higher risk of complications from the flu, even if their symptoms are mild and their symptoms are controlled. Since patients who have COPD have sensitive airways, inflammation caused by the flu can cause the symptoms to become even worse. Patients who have COPD are more likely to develop other serious illnesses like pneumonia or other respiratory diseases. So when should you get this vaccine? Typically, people get this vaccine in the winter and the fall to get themselves protected. What are some things that you should be mindful of before getting this vaccine? If you have a severe allergy to eggs, or if you're just not feeling well in general, we suggest that you do not get this shot. All right, so we're going to talk a little bit about the side effects of the flu vaccine. So the flu vaccine shot side effects are soreness, redness, and swelling at the site. You may have a headache, fever, nausea, and muscle aches. And typically this vaccine will give that in your shoulder. All right, so now we're going to talk about the pneumococcal vaccine. So according to the Center for Disease Control, the CDC, it is recommended that people with COPD get these pneumococcal vaccines once as an adult before the age of 65, and then 2 more doses at the age of 65 years or older. So now, this is quoted from the CDC, that adults through age 64 with lung disease, including asthma, need to get vaccinated with Pneumovax. If you haven't been vaccinated, you should get 1 dose now, and then at the age of 65 or older, you will need 1 dose of Prevnar if you haven't received it previously, and a 2nd dose of Pneumovax, which would be provided at least 5 years since your first dose, your initial dose. And then Prevnar and Pneumovax, they're usually spaced 1 year apart. So you'll get one, and then you'll get the next one a year later. So we're going to look at the side effects, which are very, very similar to the flu vaccine here. So pneumococcal vaccine side effects are soreness, redness, and swelling at the site, stiffness in the arm where the vaccine was given, muscle pain and joint aches, fever, chills, nausea, vomiting. And again, typically this vaccine, it is given intramuscularly in the arm, shoulder, or thigh. So I'm just going to explain to you a little bit of how you're going to get this shot. It may have been a while since you have received a shot, so I'm just going to break it down. It's very simple, very quick. So your shot is going to look similar to this beautiful, beautiful drawing here. So we're going to take your arm, your shoulder here, and we're going to wipe that off with an alcohol swab, and then we'll let it dry for about 15 seconds, and then we'll give you your shot, and we'll push that vaccine in, and you're good to go. You might feel a little pinch, but that's all. Very easy, okay? All right, so we're going to wrap up here, and I'm just going to talk about, just do a quick recap. You've learned today about what COPD is. You've learned about the risk factors of COPD, and those are secondhand smoke, genetics, age, environmental factors. You have also learned about the signs and symptoms of COPD, which are the increased breathlessness, frequent coughing, with or without the sputum, wheezing. You've also learned about smoking cessation, the different tips and ways to help you stop smoking, the signs and symptoms of an exacerbation of COPD, and the medications that are available to you to better help cope with this illness. The ultimate goal here is that we want you to better cope with COPD, and we hope that you found this educational session helpful. And remember, get the flu vaccines. There's nurses here who will help you through, and it'll be very quick. Thank you guys again. Have a good day.